Welcome back to Champions of Care. Today we're talking about breast cancer. Women have a 1 in 8 chance of developing breast cancer, and those are some serious odds. We're going to talk in this segment about why it's so important to get that early detection and what the easy techniques for early detection are. With me in the studio is Dr. Sophia Roumanis. You're a radiologist and you practice at the Oakwood Breast Care Center in Dearborn. Welcome to Champions of Care.
Thank you.
Now, tell us about mammograms. What exactly is a mammogram?
Well, a mammogram basically is an X-ray picture of the breast. We usually do 2 views of each breast so we can get a better picture of what's in each breast and go from there. But basically, it's 2 views of each breast, and we then try to look for breast disease or breast cancer.
Now, I've heard all kinds of controversy of late about how frequently you should have them and when you should start. What are the facts about that, Dr. Roumanis?
Yeah, and it's true. There have been so much out now in the media. Basically, the American Cancer Society guidelines, along with the American College of Radiology, they both say a basic screening mammogram should start at the age of 40 and have your mammogram once a year after that. Those are the basic guidelines.
Now, we just heard about the importance of family health history. So you told us the basics, begin at 40, once a year after that. But what about if my family health history shows breast cancer?
There are times, and this is something you really need to work with your physician, because a woman can have a mammogram as early as the age of 30, or 10 years less than a patient. If you have a sister or a mother that had breast cancer at age 40, you start your mammograms at 10 years before that. They try to make it 30 being the earliest, but we do mammograms on patients that are 25, 28 years old when there's a strong family history of early relatives that have early breast cancer. If you've had Hodgkin's disease or any reason why you've had radiation to the chest early in life, those are higher risk patients that get mammograms earlier. If you have, as you heard earlier with genetics, if you have a gene mutation, that's another thing to talk with your doctor for other testing, which is including mammography, and we'll talk maybe a little later if you want about breast MRI with screening.
Now, we are talking about the different techniques for screening. So at 40, typically, once a year for that mammogram. But what about these breast self-exams? I don't know how many shower cards I've seen floating around. What's the deal on that? Does that really detect anything?
Usually a breast cancer, when it's that big where you're feeling on your breast self-exam, is bigger than we like to do when we try to get early detection with a mammogram. However, it's very important for a woman to know her breasts. Every woman has different lumps and bumps, and it's good to examine your breasts once a month, starting at age 20, so you know your breast tissue. Engorgement with hormones happens, so a lot of times the menstruating female should start doing her self-breast exam a week after her menstrual period ends. But try to be consistent and do it once a month. There's no reason to keep checking the breast tissue. Sometimes there's focal pain, sometimes there's nipple discharge. Those are things you want to consult your doctor at that point, go in for more testing. At that point.
So once a month, do my breast self-exam. Once a year, get that mammogram. What are some of the other technologies for early detection or detection at all?
Sure.
You mentioned a couple. I think MRI.
Basically, the mammogram, of course, is always the gold standard. But dense breasts, there's women, and that's out in the media a lot. If you have very dense breast tissue, mammography doesn't always find everything you need to see. Breast MRI shouldn't be just a basic screening tool. A lot of people just say, can I just get an MRI? A lot of things light up on MRI, which are not cancers. It's just extra areas of blood flow. So women that have strong family history of breast cancer after genetic testing, sometimes they need to have yearly MRI exams. Women that have newly diagnosed breast cancer, they're screened with breast MRI called screening to see if there's any other areas in either breast that we can't pick up by detection with mammography. So there are areas that you can screen with MRI rather than just problem solving. That's more for, again, the more higher risk patients. But that usually isn't your basic screening tool. Ultrasound, a lot of people say, just do an ultrasound for me. I don't want to be, compressed in the mammogram machine. Ultrasound is very, very difficult to do the whole breast. There are some studies and trials going on now where they have machines that are examining the whole breast. It would take a technologist or radiologist probably a half hour to an hour to really scan the whole breast, and then you're still missing things because you just change your wrist and it can be a difference in what you see. So that may be in the horizons, but ultrasound and MRI should be complementary tools to your mammogram for problem solving.
Mammogram is
key.
Fundamental. And then women have come to learn that there's something special about digital mammography, and our Champions of Care video team went to see you at work so we can learn a little bit more about why digital mammography is so exceptional. Let's take a look.
Okay. Welcome to the Oakwood Breast Care Center. I want to show you a digital and a film screen mammogram and show you the differences between the two. I have a sample here of a woman with a digital mammogram and a prior film screen mammogram. As you see, it's a very dense breast tissue, and digital mammography is very good for very dense breasts. When they first started out, that's what their primary use. Now we use it for all women's breasts. As you see here, this white area is dense breast tissue. When we look at a digital mammogram, we have many options, and we also can magnify the area as well. And here you can see there's little tiny white dots. Those are calcifications and how well they show up on a digital mammogram. And you see the skin. This is the area of the armpit. We check for lymph nodes, and there's a lot of great detail. Film screen mammography, you still see quite a bit of detail, but there is a difference. And this is a couple years ago, so perhaps this woman didn't have those calcifications, but it would be hard to say on this film screen mammogram. The contrast isn't as good, but that's still diagnostic to read. But those are the differences, and there's so much more we can do. We can magnify it. We can actually magnify it even more, and you can see the details on it. So digital has brought us a long way in helping fight very early breast cancer.
Now hopefully a mammogram will show nothing of concern, but what happens if it does? What happens if something is found on a mammogram?
Well, as we do with mammography, you get your screening mammogram, and the radiologist will sit in a quiet area and really scrutinize the breast tissue and look closely. If a radiologist sees a density that's different from one side or the other of the breast, or something new from the other year, that's why it's so important to keep doing your screening, because changes in the breast take a couple years for breast cancer to really show up. If there are calcifications in the breast, if they're new, or there's something that weren't there before, it's your first mammogram, then you have to bring the patient back. And when a patient is called back, most of the time we try to tell patients not to be alarmed. Most things are just tissue that's superimposed or calcium that's new, but most calcium is in cancer. We just have to do more cone-down images, maybe ultrasound and target in that area to be sure that there's nothing wrong.
You want to be sure.
And we want to be sure, so we scrutinize and we do call patients back. 8 to 10% of patients are called back, and it's just to be sure that everything we see is accounted for.
Now sometimes you need a biopsy. What's a biopsy and how does that work?
Well, it's a good question, of course. When we do a mammography and we call somebody back, or we see something of concern, a new mass, change in the architecture of the breast, some calcification, we will suggest a biopsy. And what that is we have a special needle. We numb up the breast, like going to the dentist's office, the same numbing medicine. We have a special vacuum-assisted needle that actually samples the exact small area where we're seeing on the mammogram. We either do it, if it's calcium, what we call stereotactic biopsy, which is a computer that helps when the radiologist targets it and shows where it is, and we take a sample of the calcium. If it's a mass, we actually do the biopsy under ultrasound with the same needle. And we take those samples and send them to the pathology department where they do the staining and check and see what the tissue is, if it's cancer or not.
Now I'm glad to hear you say that you numb the area, but that still sounds a little scary. And I'm sure if someone is hearing that, they would like someone to help them through the whole process. And at our Oakwood Dearborn breast care site, we have nurse navigators who help a woman through every step of that process. We have a video element that the Champions of Care team put together to show us how those nurse navigators help us through a biopsy. Let's take a look.
Oakwood Breast Care Center-Dearborn is a comprehensive breast care center where you can truly have everything that you would possibly need from diagnosis and treatment of breast cancer in one building. We have an excellent, very caring, experienced staff here that truly care for their patients exactly how they would expect to be treated. Our navigators are very important as far as the quality of patient care that we can provide for our patients. They're there to really support and guide the patient through treatment and eventually diagnosis.
One of the parts of my job that I enjoy is doing the education portion, and on my desk I have lots of visual aids, written material, so that when they leave, if they have not taken in everything that I've said, then they have written information that will explain the whole procedure. My goal for the patient would be that they would feel comfortable going through the procedure, that they understand basically what will happen to them, that they won't be frightened, and that afterwards that they'll feel that they were told what they needed to know.
There's two different ways that you can do a biopsy, and what the radiologist will do is take specimens that are of a suspicious area and send it off to pathology. Usually when the patient comes into my room, I will go ahead and explain the procedure that the radiologist has recommended for them, and if they have any questions or concerns, I will go through everything until they understand before they leave the room. I give them my phone number. If they have any questions after the fact, because sometimes they're not really listening in the room, they're so nervous, and I give them brochures as well. They can take home with them to read and go over that, and just contact me if they still had any questions. I am so lucky to be working with such wonderful co-workers. They're so helpful, so optimistic, very caring, very positive. If I were to have an exam or a test, I would come here as well.
Dr. Roumanis, what would you say to a woman who isn't getting regular mammograms, who might be afraid? What would you say to her?
Well, that's a very general question and a very popular question. Many women are afraid to get their mammogram, and things like what you're doing today is very important. A woman should try to realize that when they come in, you can catch a breast cancer early. Being afraid and not getting the answers early, how your breast tissue is, and they'll find out most things aren't cancer in the breast. And it isn't as scary. If you do it once or twice, you will feel comfortable to go back and get another mammogram. And a woman that has a mammogram should tell her relative or her friend, you got to go get your mammogram. So we all have to help each other and tell everybody it's not as scary as it sounds. It's really a quick test. It's a little uncomfortable, but not unbearable, and most women do just fine. So it's so important to find early cancer and early detection.
And we women have to encourage our girlfriends and our sisters and make sure they're getting in once a year, even if we have to pick up the phone and make that appointment ourselves for them.
Definitely.
Dr. Sophia Roumanis is an Oakwood-affiliated radiologist practicing at the Dearborn Breast Care Center. We're so happy that you came in today to talk to us about breast cancer, and I just want to thank you so much for being here today.
Thank you for having me. It was great.
And if you haven't scheduled your annual mammogram, we encourage you strongly to call 543-WELL. Call the folks at Oakwood, we'll get you connected. We can even help low-income women find financial assistance to have that breast cancer screening. Coming up in just a minute, we'll talk with a breast care surgeon about treatment options if indeed you find out that something isn't quite right in your breasts. Stay with us, we'll be right back.